Good morning, everyone. My name's Alex Vitale. I'm professor of sociology at Brooklyn College and the CUNY Graduate Center and coordinator of the Policing and Social Justice Project. During my tenure on Mayor Mamdani's transition team subcommittee for community safety, I initiated a public policy briefing for strictly for the transition team and the incoming mayor's staff. We did an hour and a half long briefing on mental health crisis response, in which we talked to frontline workers, peer advocates, clinical specialists. And we've decided to do these briefings now in a more public way to both hopefully influence the incoming administration, but also to share these ideas more broadly. And so today's briefing is the first public briefing of the Policing and Social Justice Project. I'll put our link in the chat. And our next briefing will be on March 10th, and it'll be on Sentinel event reviews in the occasion that there is a police shooting. This is a strategy used by hospitals. It's used in transportation accidents to try to figure out what the policy failures were that contributed to these adverse outcomes. Too often, we limit these conversations about police shootings to whether or not the officer broke the law or violated policy, when the laws and policies are quite permissive. And we never really get to the conversation of what were the policy failures, what were the practices that led to this undesirable outcome. So that'll be on March 10th. We'll put the registration link in the chat as well, and we hope you can join us for that hearing as well. And in that registration link, you can leave your email address so that you can be in regular touch with our project. I'll lastly just say the Policing and Social Justice Project was created about 10 years ago. It's a collaboration of faculty, students, and community-based organizations that uses research and advocacy to produce safer and more just communities. So I want to thank you again for joining us this morning. We will be recording this session. There will be some Q&A at the end, but we're going to prioritize any members of the mayor's administration or the transition team, and then we'll see what time we have left after that. Thank you again for joining us, and I'm going to turn it over to Victoria Von Black, who's going to be our moderator for the rest of the morning. Thank you.
Thank you so much, Alex. It'll actually be me and my curling rods because, like a true New Yorker, we don't have a lot of time, and I just had no time to take them out. But thank you for that, and everyone for being here. Happy Friday. It's wonderful to have such a turnout at such an early morning. Hey, we're here to talk about sex work policies in New York City, one of the places that has been, mother, and at least to me in the US, to sex work has been a safe space for so many of us that have helped groom and cultivate and secure and keep a lot of us very safe. And now things are changing. And so we're trying to figure out how can we make this a safer place, a better place for everyone to be. Next slide. As I said before, my name is Victoria Von Black. I am the Director of Contracts for Trans Equity Consultants. And I'm here with some amazing panelists, and I invite everyone to come off and introduce themselves.
Hi all, I'm Kaylee Coleman. I'm one of the organizers with Decrim New York. I primarily work on our comms team, and I've written a little bit about sex work and policing.
Thank you.
Good morning, everybody. My name is Jessica Peñaranda. I use she, her pronouns. I am a partner at Reframe Health and Justice, a consulting collective of queer BIPOC femmes working at the intersection of harm reduction and racial equity.
Morning, everyone. Elena she, her. I'm speaking as a behalf of a core member of Red Canary Song, but I am also Associate Professor of American Studies and Ethnic Studies at Brown University.
Thank you.
Hi, everyone. I'm Adrian Guzman. My pronouns are he and him, and I'm the Director of Policy and External Affairs for the New York City Health Department's Bureau of Hepatitis, HIV, and STIs.
And good morning, everyone. My name is Ivan Monforte. I use he and their pronouns. I'm the Priority Populations Coordinator in the Bureau of Division Management and Systems Coordination within Disease Control at the New York City Department of Health. Prior to joining the Department of Health, I worked directly with community for about 2 decades, mostly providing sexual health and drug health education to unhoused young people.
Good morning, everyone. I'm Nadia Swanson. I use they, them pronouns. I'm the Senior Director of Advocacy and Global Programs at the Forney Center. I've been working with sex workers in a clinical capacity or advocacy capacity for 10 years at AFC, or also at Cowan Lord's Coin Clinic. And in my personal capacity, I wrote Mayor Mamdani's LGBT platform.
Thank you very much. Councilmember Tiffany Caban will be with us a little later. But
Hi,
I'm here to
everyone.
listen.
you are here? I'm so sorry, my love.
No, you're good, but I just, I got to be here I could listen to y'all talk all day. So I'm going to be quiet now, but just wanted you to know I am here.
Again,
And I wanted to introduce myself as well. Hi, I'm Gigi Thomas. I'm from BPPP, Best Practice Policy Project. I've been in the field now for over 20 years. And I'm a contractor now, but I've done a lot of work in the Washington, D.C. area. And now we're doing work in New Jersey as well as Baltimore.
well, I appreciate you, Gigi. Welcome.
Thank you.
Just to do some level setting, we're here to discuss sex work specifically, and sex work is not trafficking. I think that a lot of times it gets very conflated between sex work and the sex trade. And so we just wanted to get at some understandings to begin with, right? And a lot of people talk about trafficking because, they want to make sure that people are not being exploited, but I find that there are bigger areas where trafficking shows up, and we don't see nearly this much pushback or nearly this much conversations, like the restaurants and agriculture, construction, domestic servitude, and especially if you love a good a wild caught piece of fish, a lot of that is, people catching that fish are being trafficked. So, keep the same energy that you have when you think about trafficking sex workers for other fields of exploitation. Also, when we think about what sex work is about consent. Sex work are for people who are, over the age of 18 and can, like any other form of employment, all right? And so we think about choice. And what is choice? In my opinion, we're living in this capitalistic society. I don't know how much of choice we have like that, but here we are. Choices you're able to freely and voluntarily choose to engage in any activities, right? You can say no, you can walk away, there are no consequences. Circumstances, these are situations, due to external factors. I call myself a opportunistic whore. Because if I'm riding that subway and someone's delightful to look at, and they're going to pay me what I want, well, I guess I have company for the night. That's what we think of. At least that's what I think of when I think about circumstances. What are the things that help you get to that decision? And again, I can say no. I can choose not to engage. But then we have coercion. That's when you really don't have a say. That is when there is something that is held over your head. Maybe a passport, maybe information that you don't want to get out. Maybe, taking advantage of a drug addiction, right? There are certain ways that people use to manipulate other individuals to get them to do what they need them to do. And with that being said, I am going to pass it to Kaylee to tell us more about this, what we're doing here today.
Thanks so much, Victoria. And thank you, Alex, also for opening up for us. Again, my name is Kaylee Coleman. I'm one of the organizers at Decrim New York. Thanks so much for the opportunity to speak today. I'm going to cover two primary questions before we hear from our other speakers, one being sorry, I think I was muted. And what does sex work policing look like in New York City today? So to answer that first question, the umbrella term of sex worker encompasses a broad array of different types of workers within the ecosystem. It can refer to street-based workers who in New York are largely centered in Queens, Upper Manhattan, massage and spa workers, strippers, dominatrixes, cam models, sugar babies, and survival workers. These roles often fluctuate and overlap. A given sex worker may shift from one position to another over time, or may work in multiple modes simultaneously. So it's important to note that in sex work, like any other labor, is stratified by race, class, and gender. We use the term the hierarchy to refer to the I think there's a mute issue with the hosting. It keeps muting me accidentally.
Sorry,
Ferris.
someone's audio was coming in, so I had to mute everyone, and then you can unmute yourself. Sorry.
No worries. Thanks, Alex. Okay, so we use the term the hierarchy to refer to the internal hierarchy between workers, or the varying access to power and security experienced by different sex workers along this spectrum. So as you can see on this slide, the hierarchy largely reflects the degree to which a given worker will be stigmatized by their proximity to sex work, and may also reflect increased experience of discrimination, both from other workers, clients, and the state. So factors that impact where workers will fall in the hierarchy include ethnicity, money earned per hour or rate, perception as a quote high-class worker, place of work, disability, drug use. You can switch to the next slide, Ferris. English fluency, frequency of work, criminalization, and importantly, proximity to sex. In general, the closer a worker is to physical sex acts, the lower on the hierarchy they will be perceived. So I want to stress here an important point to note about sex worker identity, which is that the category is very broad. Many different types of people engage in sex work and are affected in varying ways by its criminalization. Okay, you can go to the next slide, Ferris. So I'd like to move on to the topic of sex work policing in New York City as it stands today. I'll give us a brief overview of the Adams administration's approach to sex work, and then discuss a few ways in which Mayor Mamdani can adapt the current framework to better protect his sex working constituency. So in October 2024, Adams and Councilmember Francisco Moya launched Operation Restore Roosevelt as part of the administration's Community Link initiatives. And though the stated goal of Operation Restore Roosevelt was, quote, improved quality of life along the Roosevelt corridor, it's primarily been used to target consensual sex workers, nearly 400 of whom were arrested and stripped of income between the launch of the initiative in October 2024 and June 2025. Though the administration claims to provide, as Adams has suggested, the resources that sex workers need as they move from, quote, a life on the street, in reality, many are simply cast into the city's shelter system. Arrests disproportionately affect sex workers of color, effectively excluding undocumented and other at-risk workers from the protections it claims to establish. You can go ahead to the next slide. So, though all sex workers are to some degree at risk because of criminalization and have been increasingly so at the federal level since the implementation of FOSTA SESTA in 2018, street-based workers have the highest degree of exposure to law enforcement. Public visibility dramatically increases the likelihood that a sex worker will be negatively impacted by policing. And because many street-based workers are either undocumented or have precarious immigration status, there are increasing concerns that over-policing of the Roosevelt corridor in particular could worsen an already horrific crisis, deportation crisis, as ICE presence increases in New York City. So on that previous slide, you can see 2025 arrest data by borough, which has been helpfully visualized for us by the students at Fordham Law School. Queens represents 81% of all prostitution-related arrests last year, with Brooklyn the second most concentrated arrest borough at 10%. Arrests by race show that 55% of prostitution charges are white Hispanic, while 38% are Asian or Pacific Islander. So simply by looking at this arrest data alone, we can clearly see that in its most recent iteration, sex work policing has overwhelmingly targeted sex workers of color in Queens. So from a practical standpoint, all of us at Decrim are aware that Mayor Mamdani is limited in his capacity to work around state legislation regarding sex work. However, it's really important to understand that the prosecution of sex work related cases in the city, particularly those in Queens I've highlighted today, can be influenced by the mayor's approach. So in a practical sense, acting in solidarity with sex workers could mean immediately halting the efforts of Operation Restore Roosevelt, directing borough DAs to halt sex worker arrests in their jurisdiction, and vocalizing his support for sex work as legitimate labor. So with that, I'm going to pass it along to Jessica, who's going to tell us a little bit more on this topic.
Yeah, thank you so much, Callie, for that framing. And so thank you again for this opportunity. As I said, my name is Jessica Peñaranda. I am with Reframe Health and Justice. I'm here to talk about alternatives to the criminalization of sex work and to really anchor that in the conversation that we have already started, right? But really to think about what real community care and community safety actually means. If we say we care about safety for everyone, then we have to confront the reality that people in the sex trades are often left out of that vision or treated as the threat to it. So as a collective, we advance harm reduction, racial equity, and community-centered policy solutions that really are anchored in principles of healing-centered harm reduction. I'm speaking from nearly 2 decades of working as a harm reduction worker, a community care worker, and anti-violence advocate, supporting sex workers and survivors of trafficking. I have supported people through violence, through arrest, through housing loss, through family separation, and through discrimination in healthcare and social services here in New York City. I want us to really think and imagine before we talk about policy, how we define safety, who feels safe, who is protected, and who is sacrificed in the name of public order. Too often, safety has been defined as surveillance, arrests, sweeps, and removal. But for people that we've worked with, many of us here on this call, that vision of safety feels like fear. It won't define safety through dignity. We don't define safety through dignity, health, and belonging. It continues to be defined through punishment, and punishment is not protection. As we've talked about the spectrum of choice, circumstance, and coercion, we understand that people enter the sex trades through many different pathways. Some people are exercising that agency. Some people are navigating poverty, housing instability, immigration vulnerability, and lack of economic opportunities. Some are experiencing direct exploitation or trafficking. And in exercising those agencies, people have limited economic options. People are navigating housing instability, debt, caregiving responsibility, immigration vulnerability to what Callie just mentioned, and high discrimination in traditional labor markets, right? We understand that criminalization does not respond differently across that spectrum. It actually flattens it. It treats this complexity as criminality, and it treats survival as defiance. It's really the vulnerability that criminalization has increased. We understand the root causes to be the housing instability that happens after those raids or police activities, the loss of employment opportunities, the barriers to public health, the increased immigration risk, the fear of walking into a clinic that's going to stigmatize you, that's going to think that you are a trafficking victim instead of actually seeing you as a lived experience, and where your self-determination should be valid. It isolates you from community due to this stigma. Like I said, I've supported so many survivors that have been traumatized during arrest, that have been too afraid to report violence because they fear being arrested themselves. They have been pushed further underground, working in more precarious and unsafe conditions, further exposing them to harm, all in the name of safety. So we understand criminalization as a structural harm, even when there is no physical abuse, right? People are losing their housing, they're being denied so many access to benefits. That is their right. Parents fear child welfare involvement. And the thing that we also need to talk about is community level harm, the surveillance, the stigma, and the association laws that make it risky for people to maintain supportive networks. Friends, family, landlords, and coworkers can be criminalized. Entire communities are going to push and do push sex workers and survivors of trafficking out rather than address the underlying conditions creating the vulnerability. We also have to name stigma. Fear and moral panic has often driven the push for criminalization. Certain people are framed as disposable or as threats to public space. The wider community has a critical role to play here. This stigma and fear drives criminalization, and unless as a community we take accountability, invest in being in relationship with our community members that are sex workers and survivors, and change those conditions, these policies will continue and vulnerability will increase. So what would a public health and community care framework or approach or alternative look like? It would really center and shift the question from who do we arrest to what conditions are creating the harm and how do we change those conditions. Safety and community care could look like stable housing, healthcare without fear or arrest, economic opportunities and labor protections, actual trauma-informed, healing-centered harm reduction that is survivor-centered, that does not require cooperation with criminal legal involvement, peer-led outreach and harm reduction, accountability process that address violence without defaulting to incarceration, where people have stability and access to these resources. We have models. We have models globally. We have models here in New York City. There are sex workers that are doing peer community-led outreach, that are in the streets giving people condoms, that are thinking about how we keep our community and our network safe. What would we look like to invest in spaces that are run by and for sex workers and survivors, where we offer health, safety, and trauma-informed support, like the Coin Clinic at Callan Lord, like the Sex Workers Project that is supporting immigration services for survivors? What would healthcare access look like without fear, where clinics and outreach services providing STI or HIV prevention, mental health, and reproductive care that is actually competent in supporting workers and survivors? What would it look like to have housing security, where policies ensure that people can remain safe in their home without the fear of eviction because they're working or being policed or surveilled? What would labor protections and economic support look like, where we recognize that sex work is work without workplace safety, where we have anti-discrimination protections and access to benefits? And community-led safety initiatives. What would safety planning with your neighbors look like for people that are working in the street? What would it look like to be a bodega that gives that coffee or a bagel to that sex worker after a long night and doesn't call the cops because you don't want to see them in your street? What would a community dialogue look like as an alternative for stigma reduction that is co-created by those that are most impacted? The wider community, Mayor Mandami's office has a responsibility to also play a critical role here, where stigma and fear are often what drives criminalization. And unless we as a community take accountability, we invest into the relationships with survivors and with workers and work to change those conditions, harm to workers and survivors will continue, and we will be responsible for that. So finally, I want to close by leaving us with another reflection question. Do we want control or do we want safety for our community? Control relies on surveillance, arrest, and stigma. Safety requires us to be courageous, to listen to our community members, including sex workers, even if we don't want to see them as part of our community. It requires investing in our people and in our communities. Criminalization is a public health and human rights failure. Decriminalization, harm reduction, and community care saves lives, reduces violence, and strengthens our community. By reimagining safety through public health and community care frameworks, we can ensure the dignity, the protection, and the rights for survivors, for sex workers, and for all people at risk of exploitation. Thank you.
Thank you. I just was able to get off off mute. Thank you very much for those words. Next, we're going to have Elena.
Thanks so much, Victoria. Thank you, Alex, for bringing us together. Thank you to everyone for joining this morning. It is my great honor to speak as a core member of Red Canary Song. For those who do not know, Red Canary Song was founded in 2018 after the 2017 death of a Chinese massage worker named Song Yang, who died during a police raid on her workplace in Flushing, Queens. Facing a potential third arrest, Song Yang fell from the fourth floor story of a window where she was working as a massage worker, while other workers had hid in the fire escape all night long to avoid detection. Since then, RCS organizers have argued that Song Yang maybe would have rather fall into her death than risk arrest, imprisonment, and potential deportation. And this is a story that we have heard over and over again in the weekly outreach that we have conducted in the past decade of coming together. In the past decade, Asian massage work in the United States has become synonymous with human trafficking. And this is a theme that I will return to again in this presentation, how the enormous infrastructure of anti-trafficking and the imperatives of anti-trafficking policing offer us only the narrowest window of how to seek the kinds of safety and care that Jessica and Callie have already talked about. So in the past decade, organizations like the Polaris Project and the Hayrick Research Project have equated Asian massage work with human trafficking. This is not an accidental conflation. This is a highly profitable one in which anti-trafficking organizations have arranged entire campaigns around shutting down, quote unquote, illicit massage businesses. This particular category, incredibly racialized category, was introduced by Polaris Project in and around the 2015s. And we thought it was incredibly important to notice that Polaris actually removed all of their web pages around the illicit massage project in the days following the massage shootings in Atlanta, which many sex workers around the country noted as their culpability for having called upon the increased surveillance and policing of Asian massage work. Nearly all of these organizations have just unilaterally conflated all Asian massage business as illicit and as trafficking, and have called in the heightened surveillance and policing that has made the lives of Asian massage workers in New York and other places that we have worked completely unlivable. Throughout our outreach during the pandemic, and leading up to the year 2021, where the New York City DAs said they would no longer prosecute sex work, we did see a shift in police arrest from policing for the code of prostitution to policing for the code of unlicensed massage. This was highly troubling for us because it allowed the policing of Asian migrant sex work and body work to become invisible and not quantified amongst this broader coalition that you see of us who are all fighting for sex work decrim. So one argument that we have is for racialized immigrant sex workers is that auxiliary forms of policing that seeks to punish their poverty, their migration status, and their sex work are now funneled under these auxiliary licenses. The New York Civil Liberties Union agreed with us so much and agreed with the research that we had brought forward that showed that this kind of policing had disproportionately targeted Asian massage workers, that they worked with us to introduce the Massage License Decriminalization Act, co-sponsored by both Jessica Gonzalez Rojas and Jessica Ramos at the time, that is currently still stuck in Albany somewhere. And that is one thing that we would love to speak more with you about. We spent a lot of time working on having people see how the arrests for unlicensed massage were equally detrimental to arrests for the codes of prostitution. And in that time, we then saw another shift. You'll remember perhaps a nationwide scandal following the New England Patriots football Super Bowl win in 2019. A nationwide raid in a spa in Palm Beach, Florida. This is similar to spa raids that you'll see, in newspapers plastered around the country that really, really celebrate trafficking being stopped at spas around the country. We have, of course, followed up on as many of these as we can find, and almost across the board, what happens in these kinds of raid and rescue operations is Asian massage workers are arrested. All of their assets are seized. They are questioned as to whether or not they are victims of trafficking. If they agree that they are victims of trafficking, they must agree to prosecute. They must agree to serve as victims in a prosecution, which almost never happens. And the majority never say they are victims of trafficking, are either jailed, released, or are shunted and funneled into the ICE deportation pipeline. Those that are released find that their businesses are closed and are faced with a completely economic destitute landscape of which they must find other forms of low-wage, precarious employment. And I think this point that Victoria started off with is the question of why do we are all so compelled to police sex, but not these other forms of precarious low-wage arrangements that people are equally working concurrently to sex and care work, or because they have no other alternatives, is a really, really important one. I pull up this case not because it's in New York, but because this particular Palm Beach, Florida case was initiated when a public health inspector was sent into the spa to investigate health code violations. And she noted presence of food in the refrigerator and condoms in trash cans as evidence that trafficking might be happening. Once again, these things, using protection, having access to food and security, are things that the anti-trafficking infrastructure has turned to justify policing, as opposed to finding new ways of honoring how people are trying to eke out their lives. Kelly had already mentioned the devastating impacts of Operation Restore Roosevelt, which we're happy to speak to at length. But one of the largest shifts that we saw during or after fall of 2024 was the shift once again from policing codes of prostitution and unlicensed massage, as I formerly mentioned, to the use of the Department of Buildings to use different kinds of civil evictions notices, illegal erection of, different building permits, violation of ADA permits, as a really targeted way to police immigrant work in our communities. The anti-trafficking organizations that we are up against, that the lobby, so to speak, is often so powerful that they get headlines like this into outlets like the New York Post, claiming that they have mapped Asian massage work and its prevalence. This article from 2021, which we think laid the groundwork for Operation Roosevelt several years later, noted that Eagle Massage Work parlors outnumbered Starbucks 2-1 in New York City. In response, here is a digital mapping project that RCS has worked on, and we welcome you to, I can share the link to this. But the basic hope of Body Workers Atlas has been to use New York City open source policing data to track the evolution of charges from 2007 to present. And the most important thing that we hope you will see to actually see how racialized policing of Asian migrant body workers happens is that whereas prostitution may have been the dominant charge in 2007, by 2016, we begin to see the emergence of the green hexagons showing unlicensed massage, all the way up to 2020, the shift to almost completely Department of Buildings violations, and the dispersal of this kind of policing represents a kind of whack-a-mole for our trilingual outreach teams that do not know how to really, really support the workers that are encountering these. And we hope that you'll take a look through the map, because we overlay the policing data with oral histories that our team has collected for the past 5 years. And they include the firsthand testimonials of different workers, including one of our lead organizers whose story is represented, and through her decade of being a massage worker still and an RCS outreach organizer, has experienced 4 different arrests that have cost her over $20,000 that match the exact kinds of shifts of policing that we see through data. Thank you so much for your time, and I will put all of these different resources into the chat.
Thank you so much for that. Next, we're going to have Adrian and Ivan.
I think Adrian's going first.
Yes, let me just share my screen. Is that working?
Mm-hmm. Yeah.
With the slides?
Yeah.
Let me see. I don't see it on my end, so let me just. Can you see the slides there?
Yes, it's
Great.
full screen now.
Full screen?
Hmm?
Great. Thank you. Thank you so much, Decrim New York, and everyone for being here. On behalf of the health department, we really appreciate the opportunity to join conversations like this. I'm Adrian Guzman. My pronouns are he and him, and I'm the Director of Policy and External Affairs for the New York City Health Department's Bureau of Hepatitis, HIV, and STIs. And my colleague Ivan and I are here this morning to give a snapshot of what the health department is doing to protect and promote sex workers' health and safety. And just to preface this, it's not enough, and it's not exactly what we want to do. We're always open to doing more and learning more. So the conversations thus far have been fantastic in terms of informing our own efforts. So I hope you'll continue to reach out to us and help guide our work. So I'll talk a bit about the specific activities we're leading here at the health department. And I also want to provide a brief overview of the New York City Task Force on the Health and Safety of Sex Workers, and close with some parting thoughts on the impact of sex work criminalization on sex workers' health and safety. So what are we doing? So for nearly a decade, the health department has led or co-led a number of activities focused on community and staff engagement. So as far back as 2017, we partnered with our New York City HIV planning group, a series of activities, including a panel event featuring provider and community partners, as well as agency staff talking about sex work, policing, and health. Our amazing sexual health advisory group convenes annual meetings with provider and community partners focused on the health and safety of sex workers. But we know we have work to do internally too. So a couple of years ago, we launched our sex work and sex worker work group. Staff from across the agency come together to ensure that we're using affirming language when communicating about sex work and sex workers. We share policy and programming updates, and we discuss data-driven strategies to support sex workers' health and safety. Last year, a couple of times this morning, Operation Restore Roosevelt has come up, and recognizing some of the shortcomings of that approach, we partnered with Voces Latinas, an amazing CBO in Queens, and convened a series of roundtable discussions. We started talking about the Roosevelt Avenue corridor and gaps we identified and potential outreach strategies we wanted to pursue, and very quickly expanded the scope to include all of New York City. And those roundtables are ongoing, and they continue to inform our efforts. And just now, we're getting started with our joint policy committee made up of provider and community partners. They're exploring some policy projects focused on sex workers' health and safety to pursue this year. And we are providing policy support and any other resources they need to conduct these projects. Lots of capacity building and trainings, everything from webinars on HIV prevention and healthcare service delivery models that are tailored to sex workers' needs. We presented at conferences on our partnerships with the community on how to address these needs. To Victoria's very important point earlier this morning, sex trafficking is not sex work, but I did want to mention that we do have some work happening in the sex trafficking space, working with clinical and school-based providers and also HIV service providers to ensure an awareness of trafficking and trafficking needs. As required by New York state law, our New York City sexual health clinic staff are also regularly trained on trafficking matters. But back to sex work, we are currently in the early stages of working with a community-based collective to support a series of trainings on sex workers and harm reduction, which would be for providers, and a training on safety planning, and this would be for people who identify as current or former sex workers and their support networks. We've led or co-led a good amount of research, and to be very clear, this research is intended primarily, first and foremost, to assess needs so that it can inform the way we respond to those needs. So we've conducted qualitative interviews with transgender women, many of whom report past sex work. We worked with Pros Network a decade and a half ago by now on a study examining the possession or use of condoms to as evidence of prostitution and prostitution-related criminal offenses back when the NYPD was engaging in this practice regularly. The CDC National HIV Behavioral Surveillance Cycle back in 2016 focused on women at increased risk of HIV and also focused on women who report current or past sex work. Just to give you a sense of what we found among women who reported exchange sex here in New York City, over 40% reported that they had refused help from the police or avoided the police because of their involvement in exchange sex. We also conducted focus groups with men who have sex with men who report current or past sex work. A number of other NHBS cycles have focused on men who have sex with men, people who inject drugs, trans people, heterosexual people, and built into all of this work are questions about current or past sex work. So we can identify need and start developing programming and services to address that need. And we are never bound by what our federal funders ask us to do. We have identified things we can do as a New York City Health Department. So we've expanded this to just be simply quantitative data collection. We've, in recent years, launched a special project to better understand the social and structural determinants of health and missed opportunities for HIV prevention among people newly diagnosed with HIV. And among those people include women who report current or past sex work. And we've started expanding our work interviewing people newly diagnosed with HIV, which includes questions on current or past sex work, so we can reshape our response to HIV and ensure that we're reaching all the people we need to be reaching. Now, just briefly, I've said the word HIV a lot in the last couple of minutes, and that's a problem. We're not talking about just HIV when we're talking about the health of sex workers, and it's the health department in no way considers HIV and STI and other sexual health needs as all the needs that sex workers have. And a lot of this is based on the challenges that the public health space has had in better understanding sex workers' health. There just simply isn't enough research. There's funding limitations, lack of institutional support, challenges around method, around ethics, and in particular, there's a constant overemphasis on behaviors, particularly risk behaviors, rather than all of the social and structural determinants of health underlying those behaviors. And of course, HIV, that's where the funding is, that's where all of the attention is, and that's problematic. And there's also an overemphasis on victimization. This obscures individuals' agency, their self-determination, and their broader lived experience, many of which are absent violence and trauma. And of course, and the health department is among the greatest offenders, but there is multi-level stigma from multiple sources that prevents actual informative, illuminating work to happen. And that includes law enforcement, and that includes criminal justice systems. So I'll briefly talk about some of the programs we have and then talk about two upcoming programs. Back in 2016, we launched our PlaySure Network, which is a coalition of HIV testing sites, NCBOs, and clinics funded to provide HIV prevention and sexual services. And one of our partners was Voces Latinas, and we enhanced their contract to support their development of a plan and a report on their successful model of reaching out to, delivering services to, and providing staffing support to the needs of sex workers in bars and other nightlife venues. We launched PlaySure Network 2.0, which expanded that model and focused on a one-stop shop model, and agencies focused their outreach efforts to one or more communities at increased risk of HIV. And I'm very excited to share that we're about to launch PlaySure Network 3.0. We just released a request for proposals. We're dubbing this initiative the Hookup and Bridge or HUB program. And this is designed to integrate all of these services into the same spaces. Clinical and non-clinical agencies will be funded to provide all sorts of HIV and STI testing services and prevention services and treatment services, but also additional healthcare services, also mental health services, also harm reduction services, also supportive services, including basic needs in food and nutrition and housing and employment and vocational support, and so on. But what's so exciting and most important for this conversation is that for the first time ever, our flagship HIV and sexual health initiative will have a service category completely focused on sex workers. So we will fund non-clinical agencies through the service category to implement all of the services I just mentioned, but also outreach and delivery models that are specifically tailored to the needs of people who exchange sex. So applications are open. You can visit that link to get more information. We hope to announce the awardees and launch this program in the coming months. And now I'm going to turn it over to my colleague, Ivan Monforte, who will talk about some work that he's been leading for the last couple of months here at the Health Department.
Thank you, Adrian. So I'm here to talk about a project that I proposed at the end of last year and was approved in February of, it was approved in February of last year. So it's been the first year of what I'm planning to be about a 5-year-long project. And it's essentially a project that is looking at the healthcare that we can provide to sex workers, mainly through our sexual health clinics. But it's to ensure that basically when they do visit our sexual health clinics, that they're getting equitable care. And it's focused on folks, right? My job is as the coordinator of priority populations to really kind of look at who those people are. And I use sort of a lens of equity and sort of the experience I've had doing sexual health and drug health in the city. But the idea is to really look at folks that are vulnerable. So folks like immigrants, folks that are unstably housed, and people who use drugs. And make sure that when they do visit our sexual health clinics, that they are receiving affirming care. And these are the ways that I plan on doing it. Next. So the idea is to do some research with sex workers that visit our clinics. And the idea is to do a survey and then do a couple of focus groups looking at what their experiences are in healthcare with providers and in healthcare settings to see sort of where providers may need help in helping sex workers and where sex workers need help in terms of working with providers. I think both sides, right, need some help. And so the idea is to do outreach, let folks know that this project is coming, and then do formative research, meaning interview sex workers that visit our clinics to see what their experiences are, see whether they've, look at the good and the bad and see how we can improve our services with them. And then the idea is to develop a training and then have a final focus group with sex workers to look at the training to make sure that it covers everything that needs to be included. So the idea is to do things like teach folks about like things like harm reduction, patient-centered care, trauma-informed care, all the sort of things that can kind of come up in a visit when working with someone that does sex work. And also really look at stigma and look at like your preconceived notions of what sex work is and who sex workers are. Just to let you know, in terms of the working definition that we're using to define what sex work is, we're using the same definition that the Coin Clinic uses, which comes from the Youth Women's Empowerment Network, which is any form of being sexual or the idea of being sexual in exchange for money, gifts, safety, drugs, hormones, or survival needs such as housing, food, clothes, or immigration and documentation. Whether they get to keep those money, goods, services, or someone else benefits from those things. And I think that sort of broadens the idea of what a sex worker is instead of sort of the imagination, right? In terms of society, we have a very complicated relationship with sex workers, right? Both high and low, right? So the idea is to create a training for providers on how to provide affirming care to sex workers. But before doing that, do a final focus group with sex workers to make sure that the training covers what they feel needs to be covered. I don't think you can work with people without having them involved in their care. And that's sort of the idea behind this project. So short-term activities are that, and they are already sort of funded. There is no funding for this project. The way it's happening is I'm in a very privileged position. I'm in a small unit that also includes a coordinator that looks at TG and CB health in New York City and a coordinator that looks at LGBTQ health. And we work in collaboration. And so thankfully, because of that, sometimes you have a little bit of money left over, a little bit of gift cards left over. from projects. And so that's how I'm able to fund these the research, the short-term activities. So the idea is to always compensate folks for their time. So anyone that is involved in the focus groups will receive compensation. Longer term objectives, these are things that aren't funded, right? So if you know any rich people that contribute, please give them my contact info. But the idea is to establish a couple of community advisory boards, one comprised of sex workers and one comprised of health providers that work with sex workers, to figure out sort of what each group needs, right? Um, and then another goal is to do a health summit for sex workers. So really bringing the community together, focusing on the health of sex workers. And then finally, I think what happens sometimes at the Department of Health is, we can do some really beautiful work, but then no one finds out about it. And so the idea is to, at the end of the project, disseminate the project outcomes at local and national conferences, so that we can all learn from this project together. And that's it.
Thank you. So I know we don't have much time left, but I did want to provide a brief overview of some excellent work that's happened over the last couple of years, not just at the health department, but across multiple city agencies and our community partners. Back in 2018, Mayor de Blasio launched the task force on the health and safety needs of sex workers. And it continued for a couple of years. Membership was made up of community members, people with lived experience in the sex trades and or people who have experienced trafficking. A number of city agencies, including those that are responsible for or whose efforts have an impact on health and safety in terms of the sex workers communities. And you can imagine that doesn't just include health department agencies, but also the NYPD and district attorney's offices. And then CBOs that advocate for or provide for the needs of people involved in the sex trades. We conducted structured interviews, focus groups, we reviewed laws and policies, and we met regularly to ensure that we developed a set of recommendations organized around 3 focus areas: programming and services that address these needs, identifying strategies around investigating and prosecuting trafficking, and shifting police policy and practice. And here's just a snapshot of some of the programming and services recommendations. None of this will be new for many of you, but we found that there were barriers to service areas, gaps in housing, including affordable, supportive, and emergency housing available to sex workers, a lack of culturally responsive providers, and a lack of pathways out of sex work for those who choose to leave sex work. Some of the recommendations we came up with are a drop-in center, a hub, a community site for sex workers, the importance of mobile healthcare, meeting people where they are, literally, grants targeting grassroots organizations, grants for educational and professional pathways for sex workers, and also interpreter trainings and language justice cooperatives. So lastly, I want to briefly talk about what the conversation is around the impact of sex work criminalization and sex workers' health and safety. So just to show you where the public health evidence base is, there's a really excellent meta-analysis of over 130 studies involving sex workers, all conducted between 1990 and 2018. I just want to emphasize this. If you could take one thing away from what Ivan and I presented, it's that these studies found that collectively, lawful or unlawful repressive policing practices linked to sex work criminalization, either part sex work criminalization or full sex work criminalization, they're associated with an increased risk of infection, including HIV and STIs, an increased risk of sexual or physical violence from clients or intimate partners, and an increased risk of condomless sex. So there are a couple of pathways through which policing practices are associated with health risks. This includes police enforcement that displaces sex workers to isolated, dangerous work settings. This kind of enforcement disrupts sex worker client negotiation and other risk reduction strategies. There's an ongoing fear of sex, which we've heard a couple times this morning, a fear of sex work related arrests or violent police practices that results in an underreporting of crimes. And of course, as we mentioned earlier, there's always fear either actual or potential fear of police confiscation of condoms and other safer sex products. And we've literally seen decriminalization of sex work bearing out public health gains, both here in the US and globally. There was a 2017 analysis of 27 European countries that showed that countries that legalized some aspects of sex work had significantly lower HIV prevalence among sex workers than those that criminalized all aspects of sex work. A 2015 modeling study suggests that decriminalizing sex work could avert between 33% and 46% of incident HIV infections over 10 years. And that's all through the combined effects on violence, police harassment, safer work environments, and HIV transmission pathways. And it's happening here too. Many of you may know back in the early 2000s, Rhode Island had a sort of de facto decriminalization of indoor prostitution. And that resulted in a 31% reduction in reported rapes and a 39% reduction in reported gonorrhea cases in the general population. So the evidence is there. I think the New York City Health Department takes our mission of protecting and promoting the health of New Yorkers seriously. When we say that, we mean the health of all New Yorkers. And what that means for sex workers is that we know that there's demonstrated evidence showing that it's important to ensure sex workers' health and safety by investing in and turning our attention to evidence-based public health interventions and interrupting cycles after cycles after cycle of surveillance and over-policing and criminalization. It's worked elsewhere. It can work in New York City. And I just want to commit to partnering with anyone and everyone on exploring how the health department can better refine our work in that area. I think these conversations are really important, and we're really grateful to be included. So thank you to Decrim New York and everyone that joined this morning.
Thank you so much for that presentation, and also acknowledging that having people, if you're going to have the sex workers, please pay the girls. And by girls, I mean of every gender. Pay us, because sex work is work. Oh, there's a strong close-up of me looking like Lock Dog. Okay. With that said, we're going to go over and pass it over to Nadia. Come on, baby.
Hello, hello. Thank you, Victoria. Hello, everyone. Nadia Swanson, they, them, Senior Director of Advocacy and Global Programs at the Forney Center. I'm very honored to be here with you all. You can go next. So if you're not familiar with the Forney Center, or AFC for short, we're the world's largest program serving LGBTQ unhoused youth. Our only requirements for any of our programs are youth are 16 to 24, homeless or at risk of being homeless, and LGBTQ. You can go. We serve about 2,200 youth a year across all of our programs, and we have really clear demographics that have sort of never changed too much. So most of our young people are BIPOC, 46% are trans, only 57% are from New York due to lack of services across the country and across the globe. The amount of minors that we've served has gone up. Traditionally, it's been about 4 or 5%, and lately it's gone up to 7%. And our largest age group is 19 of new intakes. And our amount of non-citizens has grown greatly in the last few years. And folks are really needing and surviving on sex work and other sex trades. You can go ahead. So a little bit about our services real quick. We have, we're 24/7, 365. We never close our doors. We have a drop-in center that has all the full wraparound services, one-stop shop. And at night, it's a place for our young people to be able to sleep and have a place to stay across 2 different sites. You can go ahead. And we have 14 different housing sites that offer different levels of housing, from crisis, come regulate the nervous system and just rest, to transitional, getting you ready for independence, and 2 sites of trans housing, totaling 212 beds. You can go ahead. So at AFC, we are a sex positive organization. We believe sex work is work. It is something that we have always believed but have evolved so much over the years, partially through our work through working with sex workers directly and how we can implement policies that are sex worker centered and are healing centered, and just seeing sex work as a job. Like every job has risk and harm. When I get trainings on work-life balance or, making sure that I do self-care, that's harm reduction. And we're using those same principles to make sure that sex workers are safe and treating them, all jobs, as the same without stigma. You can go ahead. So was a great study done a while ago now, because there's only very few studies on LGBTQ runaway homeless youth, but this one was specifically about youth engaged in the sex trades in New York City. What they found is half of the youth that they surveyed were unhoused, 48% were in shelters, 10% were living on the street. That they reported family rejection, shelter discrimination, and lack of gender affirming care as the core reasons for homelessness. And out of all the youth that they surveyed, 87% were LGBTQ. Generally, we see at our intake about 30% of our young people report having traded sex for money, drugs, or a place to stay when they're coming to us for the first time. Go ahead. One thing that the study also really pointed out, which is I think left out of the conversation often, but I think one of my colleagues mentioned it earlier, is actually the highest amount in the gender category was cisgender males. And that there's always a narrative that this is to protect young cis girls, when in reality, there's a diverse gender pool of folks who are engaged in the sex trades. And if we're not thinking about the boys as well in the situation, we're missing a huge opportunity. There's also very much linked to system failures, right? System failures increase instability and exploitation risk. And so young people who are often unhoused and involved in the sex trades have prior experience in child welfare, foster care placement, or juvenile justice involvement. We spoke earlier about how often sex work is inflated with trafficking, but how that really shows up and plays out in the day-to-day service delivery and rapport building with individuals. It undermines credibility, it damages the trust, and drives youth away from services, because ultimately young people are going to do what they need to do to survive. And if they don't trust us to provide them the non-judgmental care that they need, the risk of what will happen to them will continue to grow. And so if we really want to support sex workers, folks who are doing it by choice or circumstance, or we want to reduce risk of trafficking, we really need to ensure that folks have access to shelter and permanent housing, that we're eliminating employment discrimination, we're addressing immigration concerns, gender affirming care, and reducing the cycle of criminalization, which keeps people in these systems. You can go ahead. All right, so how do we do it at AFC? You can go ahead. First and foremost, we don't define youth by their trauma. We're focusing on their strengths, who they are, their identity. There's so much more than that. There's so much more than the work that they do. It's not necessarily their goals for life. It might be, it might not be, but this is where we're at, and we want to support folks where they're at. We are assessing folks at intake if they want to answer that question of have they traded sex for money, drugs, or a place to stay. But ultimately, the real conversation is, what do you need today when the youth comes to the drop-in center? What are your goals? What do you want? If they want to bring up and discuss the needs that they have around sex work, we're there to support that. And we're really following the leads and using harm reduction approach. We think about it in this holistic way. And I think the speakers right before me who are implementing really amazing programs are doing it are implementing programs that are exactly how we've always thought about it. That we need youth to have access to a holistic and robust access to care, not only for harm reduction, but to provide them with opportunities to make sure that they can get onto independence, that they can learn skills to do the sex trade safer or transfer those skills, right? That they can understand and have community with each other, that peer navigation is such an important part of the work that will keep people safe. You can go ahead. And youth are often used as the reason why we can't, decriminalize sex work, why we can't put more protections and support in for folks who are doing this by choice or circumstance, when in reality, like, sex workers do not need our saving. We are not their saviors. And that means youth too, right? And well, people who have experienced trafficking or folks who might be at high risk for trafficking need that support to be able to not be doing this in forced fraud or coercion, to not experience the violence of that. Our ability to let them have autonomy in any of those stages is what is going to help young people. And it can be difficult, obviously, to watch a young person in risky situations or unsafe situations, but it is not our job or our part of our code of ethics to stop someone from doing what they're doing. And it's our job to reduce the harm and help guide them towards what their real goals are in life. We're using a asset-based versus deficit-based framing. Youth are resourceful, they're not broken. How can we transfer these skills that they have through survival, not only as just being unhoused, maybe traveling all across the country and all across the world, to living on the streets, to building community, to the skills that they gain by being in the sex trades? How can those income generating skills be transferred? We talk a lot on harm reduction, and Cecilia always used to talk about as well, like, I am good at customer service, right? I know how to manage a budget. I know how to organize a group, right? Those are all transferable skills that if folks want to take that into a different field, or we can up those skills in digital security, in financial literacy, in safety planning, in branding, in all of those areas, to make sure that they are able to have autonomy and choice in the sex trades if that's their choice, but also make those skills transferable. That's how we can help make sure youth are on the path to safety, whatever they choose. Safety planning strategies. We're always thinking about safety. For LGBTQ youth that are unhoused, it's an ongoing issue all the time. We are safety planning verbally and formally through documents regularly and treating it as a living document. We're approaching it with how does the individual understand and define their own safety needs, and starting there. A lot of young people might not describe what they're doing for money or resources as sex trades or sex work. But it is really important that we're making sure that youth know how to do that and getting connected to community. We have a great guide that our health team created. You can go next. And I saw your note, Mandy. Thank you. We need to create more peer support for our young people. It's something that sex workers talk about all the time, but for youth, it is incredibly important. Youth listen to other youth. And it's also an opportunity for paying young people in other ways to be able to support folks. You can go next. And we need youth to be co-creators in this. Youth need to be at the table. We need youth advisory boards. We utilize peers. Paying our young people is really, really important. They need to make money. So if you want to get young people into other services to help them move to a different direction, you need to pay them or they will not come. Go ahead. And quickly about minors, since that is obviously of a big concern for folks. While legally any involvement in sex trades, whether by choice or coercion or circumstance, is legally defined as trafficking, we can't approach it that way when working with individuals. It will shut down communication. They will just stop trusting you and they will continue and they will be at higher risk for it to become a more dangerous situation. It is not our role or job to report that. It's our job to report that a young person is unhoused and they can decide for themselves if they want to continue with that. You can go ahead. You can go forward for time. I want to share just one quick client example. If you can go back one, really, really quickly. Just outlining a young woman that I worked with several years ago, through surrounding her with these wraparound services, connecting her with organizational partners, making sure her basic needs were met, is how we moved her away from trafficking, keeping her safe and consensual sex work, and eventually moving her on to some employment outside of the sex trades. And it was through really riding with her through that process of the ups and downs. We can go forward. And so what we need the shelter wait list to go down. We have very long wait lists. This is what helps make this situation so unsafe. There's employment discrimination, immigration, and anti-trans legislation. Go next for me, the last one. And so what we need from the city is increased funding for LGBTQ youth housing. We need vouchers. Vouchers reduce our wait list. They get people housed. They stop a bottleneck. I need vouchers. We can't lose our funding for peer support, which is always precarious, harm reduction employment. And lastly, I will say that we are calling as a coalition of LGBTQ providers and Decrim Coalition to increase the sex trade fund to $10 million and prioritize sex worker-led and affirming organizations. If you want to reduce exploitation and make youth safe, we have to reduce vulnerability. So thank you.
Thank you so much for that, Nadia, and that very real explanation of what's happening. We've all been young. We know we've all done some things, possibly. Some of us still do some things, no shade. But this is people are always focused on the wrong things, and it's the systems that have broken down. That is why we are here. If you don't want to see these statistics, you don't want to see these numbers, let's focus on how these people got here to begin with. It's not that difficult. But up next, we have Councilmember Tiffany Caban. Where you at, baby? Oh, yeah, I gotta be unmuted. Yeah, the mute's being funny today. You gotta keep pressing it, unfortunately.
Sorry, 1 second.
Okay, here we go. Can y'all hear me?
Yep.
All right, wonderful. Amazing. I'm really, really happy to be here. I got a little bit of a preview of this because I was having a little just like a gathering, get together, kickback. Was it what's time? Was it last night, the night before? I don't know. And the Decrim folks were there, and it was super lovely. So happy to see y'all here. I'm Councilmember Tiffany Caban. My pronouns are she, her, and I'm going to be talking about one of my bills that I sponsor to protect sex workers. And I want to say this up top and up front, especially since we have the New York City Health Department here. This bill is important, the Sex Worker Protection Act, in improving the safety, the health, and the autonomy of sex workers. And so I'm going to say really earnestly that it would be great to have the administration's explicit support of this bill. This was talked about throughout sort of the intersection of sex work in our lives, in the queer community and out, but I'm going to put it just for a moment in the context of the queer community. I was previously the co-chair of the LGBTQIA plus caucus, and we did a 2-year-long tour of every borough. We went to the Bronx, we went to Staten Island, and we met with queer folks, advocates, community members, and we did these breakouts to inform our plan for delivering as a city for our queer communities. And whether it was the aging breakout table, the youth services breakout table, the housing and homelessness breakout table, we had a dedicated table for sex work and public safety. But despite that, every single table organically, every single time, without without exception, sex work came up. There is a relationship to sex work in the experiences of our community. And of course, at the intersection, not just of queerness, but of being part of the disability community, of being part of the BIPOC community, and that list goes on and on. And, you know, what this bill aims to do, and I'll go into the specific pillars, is also put in some infrastructure to address the things that get conflated with sex trafficking, right? So, you know, if we're going to say sex work is work, then we have a responsibility as a city to legislate worker protections for sex workers. And that also puts us in a better position to be able to, instead of conflating sex work with trafficking, conflating the wage theft that takes place in the sex work industry, conflating the domestic violence that takes place, and gender-based violence and intimate partner violence that takes place within the sex work community that gets conflated with trafficking, the housing discrimination, the list goes on and on. So long as that it is conflated with something that it is not, then we can't address the underlying thing. And so, you know, this bill does not, because we cannot decriminalize sex work, although obviously I'm in full support of the full decriminalization of sex work at the state level. But here's what it does do, right? It has 6 components to it. First, it establishes a sex worker opportunity program that partners with sex worker-led community organizations to distribute funds. Second, it establishes a definition for sex work in the administrative code so that we can legislate, so that we can continue to legislate to protect and support our communities. Third, it prohibits housing discrimination based on a person's current or former employment in sex work. Fourth, it creates a dedicated review and enforcement board within the Department of Consumer and Worker Protection, tasking them with working directly with sex workers to create materials and proactively outreach, and do a proactive outreach with sex workers about their rights in general, and then in relationship to the workplace issues that they're likely to encounter. So those things that I talked about, like wage theft. The fifth thing it does is it requires the ACS commissioner to report on exactly how ACS treats sex work. It makes it so that you are reporting on outcomes of investigations initiated by ACS during the prior calendar year, in which an ACS caseworker used information relating to a person's involvement in sex work, because we know sex workers also have families, their parents. And the last is it establishes employment in sex work as one of the categories of identifying information that cannot be shared. So it adds sex work as a category in our admin code privacy laws. This bill was, and I'm really proud of the fact that it was written with and alongside sex workers. And I am really, really eager to push hard to make sure that we get this passed and continue to work with y'all on this piece of legislation. Right now, the bill, it's intro 130 of 2026, so it has been reintroduced. It needs to be heard within the Committee of Civil and Human Rights. We have a different co-chair there now, so that the chair of that committee, and that is Councilmember Sandy Nurse. So we have officially asked for a hearing in her committee to get this bill heard. And that's where we are today on this piece of legislation. So I'll kick it back to y'all. I know you wanted to create space for all of the folks who have delivered such incredible information today, so that they have the opportunity to answer questions.
Thank you so much for that and fighting for what we need. We want to ask Lee to come up. We're gonna do question and answer. So anyone who has a question, and for whom? That was a good one. Thank you. No questions?
Well, I'd like to ask Councilmember Caban what the status of her bill is currently at the City Council, and whether or not she thinks there's support on the part of the new speaker for it.
Ooh, okay. So I'm gonna be honest, I have no idea whether our speaker is starting from a place of support for this bill, right? We're in a transition phase. We're getting our legs under us. We're sort of feeling out positions on a lot of different things, especially as we gear up for the budget fight. But what I do know about this speaker is that she is very responsive to political pressure, advocacy, and outreach. So I think that there is a very rich opportunity for the coalition of folks who want to see this happen. To be able to, in partnership with me, in partnership with the Queer Caucus, in partnership with the Progressive Caucus, which I'm now the co-chair of, and this bill was one of our priorities last session that we were not able to move on. And it was very difficult. We tried really hard to get a hearing. I think one, we have a much friendlier chair of the committee it's got to go through. I think if we can get together and build out a campaign, an advocacy campaign around this bill, we absolutely can get it done, whether or not the speaker inherently is inclined to like support this particular issue.
Thank you for that. Anyone else have a question? Thought? Dare I say comment?
Yeah, the chat should be enabled now for questions. And also, if people want to post their email address, they will get notices of future briefings. As I mentioned earlier, our next briefing on March 10th will focus on the use of Sentinel event reviews to look at police shootings. And we're doing that with folks at the University of Pennsylvania's law school, and folks around the country who've been involved in these kinds of efforts. So we have one now in the chat.
How have conversations gone with the new, how have conversations gone with the new mayoral administration? Sorry if I missed this. It doesn't say who it's for, so I guess anyone who would like to address them?
Everyone, I could say from Decrim New York side that we've requested a meeting, but we're still waiting on and like continuing outreach to the administration to request a meeting.
And I think on the council front, one thing that we can do, at least I can make a commitment on the Progressive Caucus side, is that when we're able to get a meeting with the admin as a caucus, I can bring up the fact that Decrim has reached out and is requesting a meeting. I certainly am planning to follow up with Ivan, who just put the contact information there, and so look out for communications from my team. I think we have a good amount of information to be hopeful around support for this particular community. But answering that question is a little hard / complicated this early on in the term. There are things that we have been admittedly very excited about, and there are things that we have seen that we have been frustrated by. And I think that's the reality of how we relate to an administrative and an executive office and the ways in which they govern. But what I would like to do is make sure that we are staying in good communication as we push these initiatives and these priorities forward.
Thank you. See, is there anything else? Are y'all in need of any? Okay, this is going very fast. Yeah, I got older millennial eyes, y'all. Ella? There you go. You should be able to unmute.
I am wondering, this could be a question for either the public health folks or the Alley. I'm so sorry, I forgot the name of the organization. Are there any upcoming teach-ins or immediate resources I could disseminate to peers of mine who might not know that these resources or these actions are available? Also, as a college student working in policy, I'm sure that there's several classmates of mine who would be interested in knowing about this as well. Is there information catered to that where they can learn a little bit more about what's going on outside of just sending them a recording of this, for example?
I can just say that I put my email again in the chat for you. If you email me, I'm happy to send you some of the like resources that we give our young people on harm reduction and accessing services. And then we are personally not planning anything else, but I'll let the Decrim folks say anything about that.
Anyone else?
Saw a question in the chat for Kaylee. I don't know, Kaylee, if you got a chance to see it and want to answer it live.
Well, I'm sorry, I think I missed it. Ferris, what was the question?
Is there any current conversation on protection of undocumented sex workers with increased impact of ICE? Would it be possible to share more on what's happening in that front?
I think that would be a great question to direct to Make the Road, who's one of our coalition partners. They work a lot with undocumented folks in the areas that I talked about in my presentation. And they're just in general a great resource on that topic. I can put a link to their website in the chat.
I saw Mateo said that he could provide support on that. I don't know, Mateo, if you wanted to answer live or they could reach out to you.
They can't unmute. Let me see if I can unmute them. And I can't. All right. Definitely reach out to Mateo. Great person. Full of information and just absolutely adorable.
I think I was able to unmute.
There you go, my love.
Thanks so much. I'll be brief. But if there are sex workers who are undocumented who are arrested, please connect them to me. I'm gonna put my email address in the chat. We constantly work with different public defense attorneys to make sure that folks are able to get their cases dismissed and to get them representation if they have any upcoming so if they have an upcoming appointment, we make sure that they get representation so that they are not going by themselves to any immigration appointments. Or if they don't have any appointments coming up, but they have a criminal case, then we connect them or refer them to other organizations that may have more capacity. So feel free to reach out to my email address and I can get them support.
Thank you so much, my loves. We have officially hit time. I'm going to thank all of our speakers today, as well as everyone who came here to learn and to grow and to support this much needed support community. Because unfortunately, it may be the world's oldest profession, but we have very little rights. And outside of our own spaces, very little support. So I appreciate you all for coming and learning something and pay the dolls, give up them coins and support community. Like Jessica said, if you see someone out there and they're coming off a shift, give that girl a bagel and a cup of coffee and have thank you for your work. Because she may have made your marriage better. All right, this was lovely. Everyone have a blessed day and enjoy your Friday.
Thanks everyone for coming. The link tree for our future meeting is in the chat one last time, and we'll make recordings available through social media, through our newsletter, and folks who gave us their email addresses. Have a good day, everybody.
Just give me vote.